All right, hello, my name is Anthony. I'm going to be doing the remediation for the Foley catheter. So I'm going to be using my general principles and safety practices the entire time, my 11 rights of med administration. I'm going to be checking for any allergies to iodine or latex because it's going to be very important. Use 2 patient identifiers, so date of birth and name. It should be on a wristband, and I'm going to be verifying the order for this with the patient to make sure I'm not doing it on the wrong female, which would be bad. So I'm going to come in, I'm going to knock, explain what I'm going to be doing. My name is Anthony, blah, blah. This is what I'm going to be doing. Hopefully, explained well and understood. So I'm going to perform hand hygiene, and I'm going to put on a pair of gloves. And I'm just going to talk through what the perennial care would be, or peritoneal care would be, as I position her for the sterile part. So I'm going to put the pair of gloves on, and then the bed's going to be raised to a proper working position. I'm just a proper working height. I'm a little taller, so it's going to be raised, and then I'm just going to braise these. So for peritoneal care, I'm going to have gloves on, obviously. I'm going to use a baby wipe. So for each side of the labia, I'm going to use 1 baby wipe. So I'm going to spread the labia, 1 baby wipe down. Discard that, spread the labia, 1 baby wipe down on the other side, discard it, spread the labia, 1 baby wipe in the middle. So from the top to the bottom each time with the different baby wipes. So from here, I'm going to ask the patient if there's any problems with mobility, just in case, because I'm going to be moving the leg so I can use this center area for a sterile field. So no, there's no problem. She said it. I know you heard it. Now I'm going to go ahead and raise these as so, and I'm going to discard these gloves because I just use these for peritoneal care, and I'm going to use a new clean pair of gloves to open the sterile. I'm going to perform hand hygiene first, and put this over here. So hand hygiene. And then I'm going to put on a new pair of gloves just so I can open this packaging. All right, so this is the part I'll go a little slower on. So I'm going to take 1 inch, open it out like this, 1 inch, open it out like that. 1 inch around like that, and then bring it out as so. Okay, cool. Now I'm just gonna grab these, set it out like that, and then I'm gonna take these gloves off. It's trash. All right, so I'm gonna get this outer edge. Okay. So from here, I'm going to make sure not to touch the inside of the left-handed glove, or the outside of the left-handed glove. Okay, so I'm going to go ahead and grab that. Okay, and then using my 3 fingers, I'm going to scoop the inside of this cuff. Okay. Okay, so from here, I'm gonna pull down. All right, perfect. Now I'm going to pick this up, throw that away without dropping my hands below my waist. So from here, what I'm gonna do is, I'm going to, okay, I'm gonna reposition this box a little bit. Yes, so I'm going to move this like that, pick that up, put it in there. I'm gonna grab this bad boy and open that up. And place that in the center as so. All right, from here I'm going to place this on the left-hand side, place that on the right-hand side. Sick. All right, so now this is my area to work with. So from here, I have my swabs, right? So I'm going to first get my lubricant. I'm gonna get my swabs actually first, just to put them over here. Then I'm gonna get my lubricant, and I'm going to open it up, and I'm going to put the lubricant in this little panel right here, okay? After I do that, I'm gonna put those back over there. All right, so then I'm gonna get my swabs and just open it up. I'll actually open these up just so I can, okay? All right, I'm gonna put that back over there. I'm gonna discard that. All right. All right, so I got that in there. I got these swabs. I'm just gonna place these in here actually. All right. So I'm going to get this. Let's see. I'm looking for this little area, this thing right here. So I'm gonna get this syringe, pop this top off. Discard that. Damn, sucker doesn't want to go. Okay, so I got that in there, and I'm just looking for this. Oops. All right. So now I'm just gonna slide this off so that I can put that tip in the lubricant. Okay, now I'm gonna lay that in the lubricant. All right, cool. So now I'm going to take my swabs and I'm going to sort of position them as so. Okay, I'm gonna take, this left hand is going to be used to spread the labia, all right? So I'm gonna spread the labia, and I'm going to take a swab. I'm going to use the swab from the top to the bottom. Get it, discard it. Second, from the top to the bottom on the other side, discard it, and then from the last one's gonna be used for the center. So as I'm spreading from top to the bottom, discard it, okay? Now I'm going to grab that, discard that. So from here, I'm going to keep this open. I'm gonna use my right hand to pick up the catheter. I'm going to insert the catheter until I see some urine coming out. Once I see the urine coming out, I'm going to insert it about 2 to 3 inches further in. From there, I want to be really careful to say this very plainly and clearly. I'm going to stabilize this catheter like no catheter has ever been stabilized before. That thing is secure as at Fort Knox. That's Fort Knox right there. Okay, so I'm going to take this other hand and I'm going to put all this liquid substance into the balloon. Okay, and after that, I'm going to set that down. And then just put that right there. Okay, so I'm going to then tug on it to make sure it's secure. Thing's secure. It's as secure as it could possibly be. Now I'm going to pick up the rest of this here equipment, and I'm going to make sure that it's attached to the side of the bed that is immobile. Immobile with a capital I. All right, and then I'm going to make sure that this here cord is attached to the thigh with this tegaderm, okay, with some slack, because I don't want their private areas to be damaged. Okay, so from there, I'm going to clean this up, and then I'm gonna fix their legs. So I'm gonna go ahead. Okay, so this is all gonna be garbage, and then I'm gonna fix the legs. So that seems like a perfect catheter to me, Foley catheter. I don't know if I could get any better. So I'm gonna go ahead and put that down. I'm gonna take these gloves off. I'm gonna perform hand hygiene. Okay, and then I'm gonna make sure I'll ask them for any pain. I'll take any urine samples that are needed just to ensure that that's working properly. I'll tell them I'll come back to check on it in about 30, 60 minutes or so. And then document, record, report, put them down back to a comfortable position for them, and put the call light within reach. And I think that's it. I'm gonna go with a yes.